Welcome everyone. My name is Dr. Meredith Gray, and today we will be opening a discussion panel for non-Hodgkin's lymphoma. So we will start with taking some questions from the audience. Let's see here. Yes, you back there in the jean jacket.
Yes, what is the etiology of the disease?
Great question. It's a malignant tumor of lymphoid tissue. It's a cancer that starts in the white blood cells called lymphocytes, which are part of the body's immune system, which helps fight infections and some other diseases, and it can also help move fluids through the body. Non-Hodgkin's lymphoma is a term that is used for many different types of lymphoma, but all share some of the same characteristics, but it's treated differently. Usually it starts in the lymph nodes or the lymph tissue, but it can sometimes affect the skin as well. Lymphomas can start anywhere in the body where lymph tissue is found. The major sites of lymph tissue are lymph nodes, spleen, bone marrow, thymus, adenoids and tonsils, and the digestive tract. Now, finding out what type of lymphoma depends on what type of lymphocyte is affected, whether it's the B cell or the T cell, and how mature the cells are when they become cancerous, and other factors. The B cells are normally there to help protect the body against germs, such as bacteria or viruses, by making proteins called antibodies. The antibodies attach to the germs, marking them for destruction by other parts of the immune system, where T cells have several different types. Some T cells destroy germs or abnormal cells in the body, where other T cells help boost or slow the activity of other immune system cells. There are many different types of non-Hodgkin's lymphoma, which can be quite confusing for doctors, even like me, who have won Harper Avery Awards. So what needs to get looked at is the type of lymphocyte the lymphoma starts in, how the lymphoma looks underneath the microscope, the chromosome features of the lymphoma cells, and the presence of certain proteins on the surface of the cancer cells. Now, clinical appearance would show a gradual enlargement of the lymph nodes, and that would be your first sign. It usually occurs in adults and is more common in males than in females. Now, in the oral cavity, lymph tissue is located at the base of the tongue, the soft palate, and the pharynx. The most common location is the tonsils and the posterior hard palate. Types of non-Hodgkin lymphomas can be grouped based on how fast they grow and how fast they spread. The two different types are indolent lymphomas and aggressive lymphomas. Indolent lymphomas grow and spread slowly. They don't have to be treated right away and can just be closely watched instead. The most common type of indolent lymphoma is a follicular lymphoma, where aggressive lymphomas grow and spread quickly and usually need to be treated right away. The most common type of aggressive lymphoma in the U.S. is diffuse large B-cell lymphoma. Let's take another question from the audience. Yes, you back there in the black hat.
Please tell me about the historical significance of this disease.
It's actually quite interesting. Non-Hodgkin lymphoma came second to Hodgkin lymphoma. It was first discovered by a British pathologist in the early 1800s, a man named Thomas Hodgkin. Thomas Hodgkin collaborated with Joseph Lister, who is known as the father of antiseptic surgery, and used his improved microscope lens to discover that red blood cells had a biconcave shape and the skeletal muscle fibers had striations. Their paper is considered by some to be the foundation of modern histology, the study of microscopic anatomy of cells. Interestingly, he didn't examine the lymph nodes he described in lymphoma underneath the microscope, although analysis of the cases almost 100 years later confirmed that they were Hodgkin lymphoma and non-Hodgkin lymphomas. Next question, please. Yes, you back there in the dinosaur costume.
Yeah, can you tell me the signs and symptoms of NHL?
So the symptoms of non-Hodgkin's lymphoma actually varies depending on what area is affected. If the lymphatic tissue in the thymus is affected, then you might experience some chest pain. So coughing, respiratory difficulties in general, and shortness of breath all can be experienced if the tissue is affected in the chest cavity. This also puts pressure on the trachea at times, causing the symptoms. Now, other symptoms that are along with non-Hodgkin's lymphoma can be a loss of appetite, unintentional weight loss, severe night sweats. You may even drench your bed sheets. a fever, fatigue, and severely itchy skin. To diagnose a patient with non-Hodgkin lymphoma, they must do a biopsy of your lymph node tissue, a chest x-ray, and run some blood tests. Now, looking underneath a microscope from the biopsy, you would determine that Hodgkin lymphoma contains cells that are called Reed-Sternberg cells, where non-Hodgkin lymphoma does not contain them. A chest x-ray is used with small doses of radiation to take pictures of the inside of your body. Now, this can help show the changes caused by cancer or any other medical conditions. They can also do CT and PET scans to show changes that are actively occurring. They can also do some blood tests, but alone blood tests cannot diagnose non-Hodgkin lymphoma. They only can help with changes of your general health. Tumor markers are also secreted by either the tumor cells or normal body cells and can help with the diagnosis as well. As well as diagnosis, tumor markers actually can also help monitor how well the cancer treatment is working and to check if the cancer has come back. Alrighty, next question. Yes, you over there in the yellow dress?
Hi. Yeah, I was wondering what the treatment for this disease is because I think I have it.
Well, ma'am, if you think you have it, make sure you consult your physician. But the treatment for non-Hodgkin lymphoma is radiotherapy, chemotherapy, or a combination of these therapies. Surgery is not a good option when treating lymphoma because the patient can have systemic involvement at the time of the diagnosis. The prognosis depends on the type of lymphoma and the extent of involvement. Your treatment depends on several factors. These include the number and the places in the body that are affected by the stage and the type of lymphoma. They are usually very radiosensitive, and that's why radiation therapy is used for aggressive cases. Resistant and recurrent lymphomas may be treated with a stem cell or bone marrow transplant after high doses of chemotherapy or radiation. The side effects for radiotherapy include red sore skin and tissue, muscle, and bone destruction in the area being treated. Chemotherapy side effects include feeling sick, loss of appetite, losing weight, feeling very tired, and a low resistance to infections, where some oral complications include mouth sores, bleeding in the mouth, dry mouth, tooth decay, and even gum disease. But side effects depend on which drugs you have, how much of the drug you have, and how you react to them. And most side effects only last for a few days or so. Okay, next question, please. Yes, sir, you over there with the snake around your neck.
I was just wondering how this is going to affect me.
That's a great question. Well, normal white blood cells have a resting time, where these cells start to divide before they are fully mature, so they can't fight infection like a normal white blood cell. The abnormal white blood cells start to collect in the lymphoid tissue and in other places such as the bone marrow or the spleen. They can grow into tumors and begin to cause problems in the lymphatic system or in the organ which they are growing. For example, if a lymphoma starts in the thyroid gland, it can affect the normal production of thyroid hormones. NHL can be treated and cured, but it is still a cancer that can take lives. This disease must be treated serious and do the required treatment to maintain a functioning life. Counseling and having a support team is extremely important due to the strain of NHL on a person. Okay, so we only have time for one more question. Hermione Granger?
Yes, Dr. Gray, I was just wondering, what are the effects on dental hygiene treatment?
Well, Hermione, with every single appointment, we do an extraoral and intraoral exam. During the extraoral exam, we look for any lymph nodes that are swollen, where the intraoral exam, we look for any swellings or masses that can be found on the gingiva. We want to look for any enlarged submandibular lymph nodes because that is an indication for NHL. When a patient has NHL, a pre-treatment oral evaluation should be done at least 4 weeks before their treatment starts. This will help identify any cavities, fractured teeth, loose crowns or fillings, and even gum disease. Problems should be addressed in order to reduce the oral complications that come with NHL. Thank you everyone for joining me for the discussion on non-Hodgkin's lymphoma. I'm Dr. Meredith Gray. We'll see you next week.